That uneasy feeling which can interfere with your social life as well as bring on physical disease. Dealing with anxiety tonight on Call with the Prairie Doc. Good evening and welcome to On Call with the Prairie Doc. While we're all experiencing anxiousness from time to time, sadly, some of us are dealing with anxiety constantly, and it affects how we interact with our family, our friends, our coworkers. It's also a contributor to heart disease and other ailments. We'll talk about fear, anxiety, maybe OCD, PTSD, phobias. But first, let's take a look at this week's Prairie Doc quiz question. True or false? Fear and anxiety are a part of life for everyone during times of stress and danger. When the feelings of unusual fear do not go away, even after the stress and danger is gone, the diagnosis is anxiety disorder. True or false? Viewers who call in the correct answer will be entered into a drawing to win a signed copy of our book, The Picture of Health. Each of my essays originally written for this show comes with a wonderful accompanying photograph by Dr. Judith Peterson. We'll announce the answer and the winner at the end of the show. Remember, you only have 10 minutes to get your answer in. But the rest of the show, we will answer your medical questions about anxiety as they're called in or sent to us via Facebook or email. Call in your questions, please. Call 1-888-376-6225 or send us an email to the address on the screen. Joining us tonight from Avera Medical Group University Psychiatry Associates, Sioux Falls, are Dr. Anthony Vaca, MD, and Dr. Wallace Jackman, PhD. Tell us a little bit about your background. We're going to start with you, Wallace. You're a PhD. It's a different, a doctor of psychology.
Correct.
Explain that a little bit.
Well, actually, my background is in social work. My bachelor's and master's was in social work through Augustana and University of Nebraska, Omaha, and I finished my clinical psychology degree about 10, 12 years ago. And so with the psychology degree, I can do more psychometric testing. Obviously, I've done some more teaching. It just gives me a little bit broader skill set.
You do a lot of counseling?
Yes. Inpatient, outpatient setting, and I also do some teaching through the University of South Dakota.
Right. So, Tony, tell us a little bit about your training. What's the difference between a psychologist, a doctor of psychology, and a doctor of psychiatry?
Well, I'm a doctor of medicine, so I am an MD, and I tell people that I am an MD just like their family practice doctor, internal medicine doctor, dermatologist, and then after medical school, you've got to decide what kind of doctor you want to be. And psychiatry is the medical specialty that works with people who have experienced changes in their mood, behavior, thinking, and sleep. And man, there are a lot of things that can affect how we think and feel. And we know that there are medical illnesses that can do that. So hormonal disruption, weird infections, vitamin deficiencies. We know prescription medicine certainly can affect how we think and feel. So can the drugs and alcohol that are out there. And so there's a lot of different things, and lots of neurologic illnesses. But then, you know, it's one thing to take a look at it from a medical standpoint, but we also know that life is more than chemicals and pills, and it's certainly influenced by the stressors that we are facing day to day, and maybe our past experiences and the stressors that are upcoming in our everyday lives. So we need to take a look at the whole picture and see how their health is, and try to do what we can to reduce the symptoms and improve their pathway or get them to the pathway of good health.
Right, so you have all those other things that are medical based, and then you come to the same world of psychological or psychiatric problems. So we're talking stresses. You know, people say stress and anxiety almost in the same sentence. What would be the difference, Wallace, stress versus anxiety?
Well, I believe stress can lead to more anxiety or worry. We know there's two types of worry. Folks will have a modifiable worry in which they worry about events or things they actually have some control over, such as maybe getting a job, finding a home, getting enrolled in school, getting the children school clothes. And so that kind of worry, which is a stressor, but that's a kind of worry that folks can modify and problem solve and do things about. The primary worry that folks have issue with is an intolerance of uncertainty where regarding the future and things that they don't have control over. What's going to happen if I lose my job? What if my husband leaves me? Things of that nature. And so those folks tend to have a higher degree of anxiety because they can't problem solve that type of worry.
Now, would you take that any further on this idea of problem solving or coping? People say the word coping a lot with this particular condition.
Well, coping is education, understanding, and also trying to, again, understand what is ailing us. And I'd like to actually, if I can, expand a little bit on the definition of stress anxiety, because it is so, anxiety is one of those terms that is so often misunderstood. And so, the stress is kind of it's a heaviness feeling that comes from the preoccupation of worrying or something that's anticipated maybe in the future that is a cause for concern. But anxiety is a fear response, and we don't always know what we're fearful of, and sometimes we do know what we're fearful of. And if we are fearful of, let's say, of heights and snakes and spiders, then those are called phobias. And so we know what we're fearful of, but we also know that we respond and react to it in an exaggerated way. And so that's a phobic reaction, phobic response. Anxiety is this feeling of, it's a fear response, but we also may not know what we're fearful of. It's our body and our mind telling us to be on guard for something that could be a threat, something that may be anticipated that we need to be cautious and concerned about. So it's a state of physical readiness to get in preparation for what, again, we may or may not know. And of course, there's all kinds of physical ways in which you can feel stress, anxiety, but there's also mental ones as well. So the mental symptoms are often the recurrent thoughts, what if, what if, and you don't really answer your question, you just keep asking more questions. And I've never met anybody who, when anxious, thinks more positive. It's always more negative. And so, when you can't be stressed or anxious and relaxed at the same time. So how are you going to recharge your batteries? So being under this kind of stress, whether it's acute stress or a chronic stress, is tiring. Yeah. So certainly then it can affect your ability to sleep, your ability to rest, your productivity. It's a busy highway up here. You're not in the moment. You just can't. So it affects so many ways. And then there's the restlessness, the stomach aches, the muscle tension. There's so many different ways. Oh, so many ways that you can feel anxious.
He described the adrenergic system, where your adrenaline kicks in response to something, and you're in this heightened, ready to run from a lion, for example. And here's a lion that's so you're getting ready to run or to attack, and defend yourself. Is that an inherited adrenergic system sometimes? Do some people inherit that heightened adrenaline?
I think some people are more genetically predisposed to anxiety disorders or things of that nature, but when I speak with my clients in the clinic regarding that physical feeling that they have associated with their anxiety or worry, we talk about that mind-body connection. And so the more that they tend to worry and focus and get frustrated and anxious about things, generally speaking, it's going to have a connection to their body. And then the more they start worrying about their stomach pains or their hernia or their backache or stomach aches or sleep problems, then that causes more worry. And so they tend to kind of play off of each other in that manner.
Yeah. We're talking about anxiety, which is a neurosis versus a psychosis. Could you define the difference?
Well, those are terms that we don't tend to use much anymore, but...
I'm an outdated guy.
It's been more...
this is an old term.
It's been defined
Be nice
better.
To me now, Tim.
When you were in medical school, Dr. Holm, So neurosis is those illnesses that may be rooted in anxiety and worry. Psychosis would be misperceptions of reality, distorted thinking. And so it was, at the time, really kind of one or the other, but we know it's so much more in depth than that.
Yeah. So if there was a take-home message that I would like to hear said, is that all of us have anxieties and wake up in the night and go negative, can't get off the same track and can't sleep some nights when something's happening to your kids or you're worried about your job, or normal reaction. Some of this is normal. Tell me that this is, we have to kind of break through it sometimes.
Well, anxiety, you have, in order to survive, you have to have a little anxiety. Otherwise, if it wasn't bred in us, when the lion would come chasing after us, we wouldn't run.
Yeah,
and
we'd be eaten.
You would not survive. So
It's a
a
survival.
little bit of anxiety is okay. It gets us going. It gets us motivated to do things. But when it gets to be too long or too much or both, then it can be worse and it can create more problems.
All right. The number of people who feel that they have more stress and that's increased, knowing that others are in that same boat can help you find ways of coping with your stress.
Anxiety can look different for different people, and people have different traits that may come out. It may be something as your hands sweating, it may be your heart beating a little bit faster, it might be muscle tension. A lot of people carry a lot of weight on their shoulders, and so being able to understand what's going on in your body, when those butterflies in your stomach are going, that maybe it's a stress response to what's happening in your life. So when you feel like you're not able to sleep anymore, when you're not able to eat, when your daily functions have been somehow challenged or impaired, those are those times that you need to come in for therapy. I was talking to our receptionists who keep track of people that have been coming in for anxiety, and what we found was in 2007, when we started keeping track, people came in about 2% of the time for anxiety, and we just recently looked now in 2017 and that number has jumped to over 18%. NAMI says that about 40 million people in the U.S. Experience anxiety, so that's about 18% of our population in the U.S. All of us have stressors in our lives. We talk in terms of trauma, that there's big T traumas in our life, whether it's being in a car accident or having a tragic death in the family or the loss of a dream. And then there may be smaller T's in our life. And sometimes we can be resilient and overcome the bigger traumas in our life, but enough of the smaller traumas can be enough to kind of set the balance of our life off. Most towns in South Dakota have schools or churches or gathering places, whether it's a coffee shop or otherwise, and being able to engage in people that will encourage them and lift them up, and also to journey with them. The more that we're around other people that are struggling, the more it helps normalize that they're not alone. They're not the only one going through this. They encourage that you spend 15 minutes in the morning, 15 minutes in the evening, being able to just relax and be able to rest. And for some families, that's hard. Some moms, I don't have time to rest. But if you're able to take care of yourself, then you're able to take care of others. So being able to spend those 15 minutes in the morning or the evening, whether it's just taking a shower and being able to relax, or just snuggling, with your loved ones, that can make a big difference. I tell my clients to create these coping cards and come up with things that they can do at home, and then also when they're outside, out and about. And so coming up with 5 or 10 things that they can do so that when they are going through those stressful times, that they have something to lean on. Being able to know your story, to live life on purpose, and feel like you have something to offer the world makes all the difference.
This is your show. Your questions are key to our show discussion. Our email's not working tonight. Call in your questions, and we would appreciate those. 1-888-376-6225. Please give us your call. We need your questions to go forward. Well, we appreciate it. We don't need your questions to go forward, but we appreciate your question. I was interested in what she said about the scope of this problem. And I looked it up in the December issue of JAMA. Behavioral health is thought to be the fourth most expensive sector of healthcare spending at $187 billion per year, with depression at $71 billion, anxiety at $30 billion, substance and alcohol abuse, which might be treatment for anxiety that are self-treated, at $23 billion, and even added to it pain, maybe back pain, anxiety pain, $88 billion a year. You think about it, this is a big expense in the $3.2 trillion price tag of healthcare in America today. His criticism is the country should pay more attention and provide better care for behavioral health and management of chronic pain, and get better quality. You could save a lot of money. That's my question to you. You think, indeed, we're giving it as much attention as it deserves? And number two, is there a way that we could be saving some money, because we're twice the cost of even the next most expensive healthcare country?
Well, I might piggyback on some of what you just read. Is it has a carryover effect into other areas of people's lives. I mean, there's a loss of productivity for people at work. They're not showing up on time for their school kids' events. They're not making it to family functions. And so it has a carryover effect into other sections of people's lives as well.
Well, and they have more heart attacks, their blood pressure's higher,
Correct.
Sleep well.
Yes.
It just avalanches.
Absolutely. When you said that number, I'm thinking, that's not the number that goes toward paying your prescription or seeing your doctor or being admitted to the hospital. Those are numbers that are mostly from other areas of life that are impaired that you are also paying to treat, and the lost wages and the loss of productivity. And so those numbers that's the high number there.
Yeah.
It isn't what it costs, but it's not what the pharmaceutical industry is making. So, because sometimes people associate the cost of their illness with how much they pay out of their pocket, and they don't necessarily understand the importance of how the anxiety is affecting their quality of sleep, for instance, and how that is a problem that's transcending now in your relationships and at work and your productivity and your happiness. And you know what? With anxiety, it's one of those things, very personal. It's one of those things where I feel like I should be able to control. Okay? I need to do this. And I'll maybe get some help, but I should be able to do it, because I'm a wuss if I can't control it.
Particularly if you're a guy.
Yeah, more so with a guy.
Yeah.
And so you have to kind of break through that barrier, and you have to understand that, right now, we just got to reduce these symptoms so that there's a better chance of you to have and enjoy your quality of life.
Yeah. One of the things that they just put up was that said 60% of anxiety is in women and 40% are in men. Do you think that's really true, or is it that the men cover it up and it presents differently?
I would venture to say men will tend to repress that more, and more willing to try to work this out on their own. The little macho Rocky Balboa kind of feeling of, I can take care of this, I can handle this, pull yourself up by the bootstraps, you don't need to be worried about that kind of thing. And so it's really difficult for men to admit that they're scared or they're worried. And we were kind of raised to, not cry. We were raised to, you need to take care of this on your own. And it's really difficult for men to really acknowledge that they don't have control over some of the things that they're worried about.
Or even to seek help.
Correct.
Or even to talk to somebody about it.
Yes.
It's all, we cover up things. And I think we are wusses. I mean, I think, you look at guys, I talk to guys in my sailing academy, of course, and and they cry at Hallmark commercials. That's the that's the sure telltale story of either they're getting old and demented, or they're really being sensitive. And I guess
I'm personally a fan of the Hallmark Channel.
I am one who cries at those commercials too. That's right. So any comments about male and female differences in symptoms?
Well, women will usually come on their own volition, and the men are usually there because their female significant other tells them that it would be a good idea for them to show up. And in the end, it usually is a good idea. And what we want to do, it isn't so much a gender thing as it is when we go and when we're visiting with people, we're looking at trying to figure out ways to reduce symptoms. And a lot of it is to, again, better identify what the problem is. Maybe they're coming in because of sadness or feeling overwhelmed when really it's more of a stress, an anxiety disorder, rather than, let's say, a depressive mood disorder. Or they don't have ADHD, they just don't sleep well, and maybe in part because they are having a lot of or problems turning off their brain to go to bed.
We have good questions, and I thought maybe
We're going to have all kinds of good questions.
This is a
there's so much
wonderful
things
topic.
to talk about.
Any advice for family members living with someone who has anxiety? My first answer would be bring that guy into the doctor, start with a primary care guy. But what's your response?
Well, a majority of folks that have anxiety disorders that go for help go through primary care, go through their general practitioner. So yeah, I certainly recommend that if they're not getting the help in that direction, that they follow up with a psychiatrist or psychologist or someone trained working with anxiety disorders. One of the things to answer the question regarding family, this is what I hear in the clinic, is I often have patients tell me that have a generalized anxiety disorder that their parents or their family just saying, oh, don't worry about that, stop worrying about that. So if you're a family member telling them that, don't do that anymore. Stop telling them not worry about it, because one of the criteria for generalized anxiety disorder is they have difficulty controlling the worry. So those aren't people that can just put worry on the shelf and forget about it. They worry and ruminate and brood and think and think and think about things, and it's hard for them to put that on the shelf. So I would tell family members, first off, do not tell them just let it go, forget about it. That's one of the issues with folks that have anxiety. They can't turn it off. In fact, let me go one step further. There's a term called meta-worry, in which not only do they worry about these things we've already discussed, then they worry about their worry. So they start worrying about the worry being so bad. And so that even compounds the anxiety even more.
I love the word ruminate because,
Yes.
of course, it's a cow word because they chew the cud and,
Yes.
then they bring it back up and
Yes.
chew it again, and then
Right.
they bring it up again.
Right, and rumination is like the dog chewing on the bone, okay?
Okay.
Whereas obsessive thoughts are popcorn. Pop, anxiety, fear, do something to reduce it, feel temporarily relieved. Pop, there it goes again. But ruminating anxiety, which is what generalized anxiety, and I hope we get into another question about generalized anxiety disorder, but that's more of that ruminating, gnawing on the bone kind of anxiety.
Okay, I'll ask generalized anxiety disorder as a group. As I was looking at this, one particular list was obsessive compulsive disorder, post-traumatic stress disorder, phobias, and then they say general anxiety disorder. Would you define that further?
Yeah, I'd love to. I want to first go with the question as far as anxiety, okay?
Yeah.
So the advice is that you don't go see a doctor because you have anxiety. Everybody has anxiety. It's when it becomes a disorder.
Right.
That's when you need to go see somebody. So everybody, again, knows what it's like to feel anxious. So how do we, in our world, try to then differentiate at what point does it become a disorder? And so it does so when at least 1, 2, or 3 things occur. One, when it adversely affects your quality of life involving your physical health. Anybody who has irritable bowel syndrome has generalized anxiety disorder until proven otherwise. The muscle tension, the restlessness, the racing thoughts, the what if, the tiredness, the insomnia. Again, those are physical symptoms and emotional symptoms that can affect and adversely affect our quality of life. So that's one, that's physical. The other one is when it involves and it adversely affects your ability to relate and to be with other people. So when it adversely affects your social interactions. When you're anxious, are you very flexible? Are you very patient? No, you're more irritable, more demanding, and so
Are you
it can.
able to listen to somebody?
What?
Listen.
No.
What?
I mean, you can't. No, it makes it very hard to. And it's very hard then, you can be very stubborn in your thoughts and your beliefs. So it can affect your social relationships, but then it also, number 3, it can adversely affect your occupational abilities to work on the job. And those are people that when they walk into work, they feel like they are working 1.5 times more than other people because of just the stress and the worry that they have going into work.
All right. Yeah. Follow up on that?
The only thing I'd add to that is that, again, they have difficulty controlling that worry. Whereas
Oh,
someone
yes.
that doesn't have the disorder, they are able to put that worry on the shelf and go to work and function with their family and wait till later to problem solve some of those things.
But another thing that also happens is a yin and yang effect. So you have somebody who is the worrier, and who are they going to partner up with? Somebody who's go with the flow. Because the person who has the generalized anxiety disorder worries enough for the both of them. And so you can't have two people, together so there's a yin and yang. And so again, and what's also, you mentioned a little bit about genetic influences. In my experience, which is getting close to almost 3 decades now, somebody who has generalized anxiety disorder, highly genetic, and there you can usually point to one parent that also was kind of a worrywart person as well.
Yeah. And I don't think it's bad to be a worrywart, except when it causes those 3 things.
A little worry's okay, not a lot of worry.
Delmont, South Dakota, panic attack meds. Talk about side effects of the meds and possible non-medicinal options. You're the non-medicinal guy. I think we overdose things, and a lot of doctors treat this with benzodiazepines, period. Is that what you do generally? Benzodiazepines, Valium, Ativan, all of the Valium-like medications. If they don't work like benzo, they also work on the benzodiazepine receptors in the brain. So explain that.
Well, again, we'll try to keep it short and sweet. So I find that often people, when they say that they think or believe that they have a panic attack or a panic disorder, they often don't. They feel panicky, and so they use that term to define or to use those words, when really it's different. Panic is, a true panic attack is an eruption, it's like an anxiety seizure. And you don't know by definition really what caused it. And so when you have within a very short amount of time, 10 minutes, where you are just feeling like all this sudden surge of anxiety and tension and restlessness and fear and oh my God, and you feel like you're having a heart attack and it hurts and you actually have true physical symptoms, and after about 10, 15 minutes you are now emotionally spent, then your brain is now trying to figure out what the heck happened.
Right.
And then it often will come up with wrong or erroneous conclusions. And then the most important thing about panic disorder, the most stressing, is the worry about having another one.
Right.
Because you feel so incredibly vulnerable because you don't know where it came from.
Right.
And maybe you woke up in the middle of the night with it. Now, a panic attack, you have no idea, anxiety, seizure. Anxiety attack, usually,
It's
again,
different.
it's an attack, it's the eruption of the volcano, but you usually know what you're anxious about. And that's the one that you would rather have, because then you can do something about it because you have an idea of what it is.
Right. Sometimes these people are hyperventilating, don't you think?
Oh, they're often hyperventilating.
Yeah. I'll give you an example of a case. I'm sitting in the movie with, I can't remember the story. It was about a train that was got loose, and it's running amok among Pennsylvania somewhere, and it's got children in it. It's going to come around a corner, and it's going to spill and kill all those children. And I was in the movie, and I was getting too anxious. I mean, it was doing what it was supposed to do, only it was overwhelming me.
Right.
So I calmly got up, walked out to the thing. I said to the people at the front of the movie theater, I'm Dr. Holm, I've got a phone call I need to answer. And I went outside. It was a nice fall evening, ran around the block twice, came back calmly, sat back down on my chair. And it brought me out of it. It's that hyperventilation. I think we put bags on their faces too often. A brisk walk, an exercise moment would help. What's your answer?
Oh, I would say Dr. Jackman is your man here. I mean, he would be able to give you some more things.
Part of that question was about the non-medicinal
Yeah,
kind of
yeah.
work. For panic attacks, the key is the person to start recognizing some of the precursors or some of the pieces that are leading up to the actual panic attack, whether it be heart palpitations or sweaty palms or breathing is starting to get shallow.
Yeah.
And so I would have those folks start with like panic logs. They just have a log of when they have these panic attacks, and then get a better feel for maybe what time of day it's occurring. Are there certain stressors or certain events occurring in their environment that's leading up to those panic attacks? Because that is the difference. That panic attacks, the folks don't really have any idea. They just come out of the clear blue sky. Whereas like an anxiety attack, that's a little bit different. And so some of the coping strategies, such as you talked about the movie theater, is some type of distraction. Diaphragmatic breathing is a common one that we would use. In fact, some research supports that if a person is able to use good, strong diaphragmatic breathing, it's almost impossible for them to have some of the symptoms associated with a panic attack because it promotes a relaxation response. And those are two incompatible responses.
I've often thought hyperventilation, you know, there's a reason to hyperventilate when you're exercising. So that generally solves a problem. I've seen people almost in spasticity. I get them in for a brisk walk, and the spasticity goes away, and they come out of it. Well, you were going to talk about.
Well, I was going to mention about the medication because medications are important because medications reduce symptoms. But, you know, when you're in the throes or the beginning of an attack, and you go and take a pill, a medication, how fast do you think it's going to work?
About a half an hour to an
Well,
hour.
a lot of these things take a little time, okay? So sometimes the act of going and doing something about it in itself is sometimes more important than the pill itself. The medications are best used to try to prevent the things from happening. And they work, though, with the education and other practicing the techniques of reducing stress and anxiety. So it's a combination, and using something because you're feeling it and you want that kind of really quick medication response is sometimes it can be helpful, but sometimes it's not really. It can do more harm than good.
And this person is on mirtazapine, which is a great medicine I use particularly in the geriatric population for sleep and energy and improve appetite, and lorazepam, which is one of those benzodiazepines.
Benzodiazepine, and
There's
again,
a time for it.
well, you know, there are roles for benzodiazepines, and they're great medications when you know how to use them and you know for what situations to use it. But you don't want to overemphasize the medicine in general for anxiety or for depressive disorders or anything like that.
Then the person becomes almost dependent upon that.
You have to work with it.
Yeah, there we go. After dealing with anxiety and depression for a decade, one Volga resident has developed the skills to help keep her stress and anxiety levels low.
I think the first time that I ever started to wonder if maybe I wasn't reacting to stress in an appropriate way was in high school. I went to see a professional and was diagnosed with anxiety and depression and told I could treat it with medication if I wanted to. But at the time, I felt that there's so much going on in high school and when you're a teenager that I thought I would see if maybe, you know, I grew out of it. So I waited quite a while. I'd say maybe until I was 22 or 23, and I decided that maybe it hadn't really gone away. It wasn't really getting a lot better, not especially worse, but I felt there's maybe something that I could do to not feel the way that I was feeling. What I really needed was for my emotions to kind of, you know, be a little more in control. I will admit when you're on medication, you maybe don't feel quite as fully as you may remember feeling. Everything's a little bit toned down. But on the other hand, when you're presented with a really stressful situation, you're a little more mellowed out, so to speak. And so it can be easier to deal with that situation as long as you're making good decisions and trying to change how you react to these situations that trigger your anxiety or your depression. I do feel over a decade later that I have my anxiety and depression under control, or at least, you know, very, very manageable. I recently did decide to stop taking my medication, you know, slowly weaned myself off of it. And there were times that I noticed in the first month that, you know, something might, start to kind of trigger where I might react a little bit, overreact really. And so I had to, take a moment and recognize that that was how I was feeling, and that this was an opportunity for me to use the skills that I hope that I've developed over the last decade in trying to deal with my anxiety and the way that I react to certain things that I consider to be stressful situations. Even though I've stopped taking my medication for anxiety and depression, I'm aware that I still have my triggers that will cause me to hunch up in my shoulders or to grind my teeth. And so I do have little reminders, like to check my posture, make sure that I'm sitting up straight, make sure that I'm relaxed in my jaw, because if I clench my jaw, then I end up getting a headache later in the day. And so I know that I still need to keep these kinds of things in mind. I still need to work at keeping my stress level low, even though I've decided that I don't want to use medication anymore, to treat my anxiety and depression. To someone who thinks that they might be suffering from anxiety or depression, I would just encourage them to talk to their medical care provider, sit down and have a chat, and find out what's really going on.
Wasn't that a nice illustration how it slowly came around? What a fantastic artist that would have done such a wonderful illustration. So, depression and anxiety at the same time.
Well,
Wallace.
one of the common reasons that's correlated or comorbid condition is they tend to play off of each other. Is the more depressed and despondent and maybe even suicidal and sleep problems a person might have and be more depressed, then they start to worry about the depression getting any better. And the anxiety can wear the person down, which leads to more depression. So they have to share some similar symptoms as well.
Now, do you agree that the 50-50 thing on that graph is correct?
I'd like to actually have it better defined, because are we talking about disorders or are we talking about symptoms?
Right.
So, I mean, when you are suffering from a depressive disorder, it's hard to be calm and be down and have that depressive disorder.
Explain that a little bit more.
I want to, again, when I have somebody come and they come to see me, okay, they are not going to leave with a diagnosis of anxiety or depression. We need to define, when I write prescriptions, I prescribe medications for disorders, not for symptoms. And so I want to make sure that we're defining really what is the problem. So are we talking about anxiety symptoms? And then you have enough of them, and they're intense enough, and they affect our quality of life to call it a disorder? That's when we start looking at medication therapy. The symptoms,
alone or
it's, we have to make sure we're clearly defining what we want to do, because if you're prescribing a medication, you should have a pretty good idea what you're trying to treat. And if you don't know, and if it's vague, then it just seems like it's hard to figure out what to expect from that medication.
Right. And this question, can medication alone improve anxiety disorder? Let's talk about medication. Of course, you talked earlier about some non-medicinal therapy. What about medicinal therapy? And we've kind of jumped around a little bit. But
The answer is definitely yes. I mean, we have very good medications. And most of the medications that we do use, especially those that may need to be continued for months, if not years, are the medicines that are called antidepressants. Now again, any medicine that's called an antidepressant, which is a misnomer by the way, any medicine that's called an antidepressant can work for other reasons, even if you've never had or never will have depression. And the second most common reason we would use them are for anxiety disorders. And the reason why they're often used is because whatever in the brain is causing the illness for a depressive disorder is very similar to what's causing the anxiety disorder. And so not only are you reducing symptoms, but you're also kind of getting to that spot of the brain or spots of the brain that may be behind the whole pathogenesis to begin with.
yeah, I so much prefer antidepressant groups, the SSRIs and SNRIs, because They aren't addictive. You don't have to raise the doses. They don't cause a withdrawal anxiety. There's just so many reasons.
Well, actually, some do. I mean, there's a couple that can be. I mean, if you're on a certain antidepressant for a while and you go a couple days without it, man, you get the heebie-jeebies on that one.
But that's your major mainstay for treatment for anxiety disorder.
Those are the main, but there's still a role of other medication. I mean, we'll use other medications that are not just benzodiazepines or antidepressants. Sometimes we'll use beta blockers, which are they keep our heart rate down, and beta blockers, for instance, are what you would use for like performance anxiety, or I'm ready to give this speech, or
Right.
I'm ready to come on a TV show,
Right.
or
But you're not on a beta blocker.
no, I'm not.
I
I'm
said
not.
that you don't need
no,
that.
but or in standing in front of the altar because you're the best man at your brother's wedding.
Yeah.
And so really what you're doing is using those medications to try to work. They kind of work from the neck down. And so what they do is they try to reduce your physical symptoms, so your physical symptoms don't remind your brain that, hey man, you're nervous.
Right, it's that adrenaline blocker. It's a beta blocker, adrenaline
Throws it down.
blocker. It goes that down.
Yeah, I don't know if we want to send the message that medication is the only solution to
Oh,
a
it's-
person's anxiety.
So let's-
Some folks are misusing their medications or being prescribed too much medication when in essence they could be using some non-medicinal diaphragmatic breathing, coping skills, strategy, spirituality, talking about things. There's other things that they could do where maybe they wouldn't need the medication at all, or maybe even lower the dose that they have. So I certainly don't want to send the audience the message that medication is their only solution to their anxiety.
I love what you're saying. I would also say that, an occasional benzodiazepine type medicine as a rescue to get you by so that the SSRIs work and so on and so forth is fine. But boy, those can get you into trouble. They're so habituative and they can cause depression.
But they seem to do that more with people who maybe have a history of not using things appropriately to begin with. And there are some people who just have an addictive personality or history, but there's other people who really don't have those histories, and they can be very effective medications. It has to go
Time and
about,
place.
but it's education. It's learning how to best use it, and knowing that these medications don't wipe away the anxiety.
Right.
They reduce it to help you. It gives you you're better able to do the things you need to do to get better.
Learn the coping skills.
And I've also seen that carryover effect into those folks that don't have that addictive personality and use the medications that they're way supposed to. They tend to do better in therapy as well, because now they're calm and relaxed enough to be able to practice some of the skills we might be working with them on in the clinic.
So Wallace, some people say that in counseling, bring them to a certain level of feeling good, but sometimes you don't want to dredge up all that old stuff. And then there's others who say the whole basis is to dredge up the old stuff, discover what it is, try to face it. What is your take on it?
Well, it depends on what theoretical background you have. Generally speaking, research supports cognitive behavioral therapy being one of the most effective types of therapy to work with anxiety and some mood or depressive disorders. Simply speaking, how thoughts connect to a certain person's emotions, and then those emotions connect to a certain behavior. So if I think I'm going to fall apart at the wedding, things are going to go horrible, I'm going to faint, everybody's going to think I'm an idiot, then I'm going to feel really anxious and frustrated and worried and uncertain. And so then how am I going to act? I might not breathe right. I might not eat. I might act. Who knows what might happen?
See where this is going?
And then it goes
Yeah.
in a circular kind of process. And so at CBT, what you try to do is change first they have to recognize their negative self-talk or negative thinking, and then try to reframe that or restructure that into something that's more positive or something more realistic.
So I'll ask you two quickly, because we're going to need to get to questions.
Oh, okay.
But I believe that everybody would be a whale of a lot better off in this whole regard of anxiety if they were regularly exercising.
Research clearly supports that. In fact, that's one of the things I tell my clients. I can guarantee you'll feel better if you exercise. I can't guarantee our medications or my therapy will work, but if you exercise 3 to 4 times a week, I guarantee you'll feel better.
I say a walk every day, and it has to be every day, and then you can get into the habit. And you're going to say the same thing.
Oh, I'm going to say that, and also people also need to learn how to relax, and understanding that relaxation is not just dead time. It is an activity. You have to learn how to relax.
I might be weak in that realm. Give me one quick way to do that, because I'm probably not one of those relaxer kind of
How
guys.
about meditation, prayer,
Yeah.
yoga? Just there being
While I'm
just-
exercising, it's one of those.
But I worry about the age now with
Yes.
you
With
know,
the
and that's
electronics.
not relaxation.
And it's not
It's
communication.
not communication
No.
either.
No, you know what was? You know what was? It was like the old Andy Griffith show with Aunt Bee bringing out the lemonade
Oh, yeah.
to the porch, and you're sitting there and you're drinking
rocking
it,
chair.
and you're just
Yeah.
watching the neighbors walk across the street.
I wish we did that more.
Oh,
Yeah, there it is, Aunt Bee and the lemonade. I love that
We're
one.
dating ourselves on
Yes,
that
we
one.
are. Okay, quick questions. Let's run through these. Explain the cause of anxiety disorders. Are they genetic or environment or both? And you said yes, strong genetics, right?
Yes, and it can be environmental too.
Okay. Caller has persistent tinnitus. She's constantly having music in her head, and it's affecting her mental activity. Is this related to mental health issues?
Hard to say. Let's just put it this way. I mean, if you have a chronic medical illness, how does it not affect your psyche? How does it not affect your ability to cope and the worries and everything? We do use medications that psychiatrists tend to prescribe for this kind of illness.
Yeah.
And this guy, and this is, and I don't want to take tinnitus or tinnitus, however you want to pronounce it, lightly. That's a real
deal.
booger. Yeah, that and it just. But some anti-anxiety medication certainly can reduce the noise.
I can tell you that chemotherapy really makes it worse. It comes on with chemo, you know, the platinum, oxyplatin. Ugh. All right, so, but you just live with it
Can I
sometimes.
add one more thing to that? Is you're talking about a medical condition, and one thing I always tell my clients, there's always 3 or 4 things that are going to increase their anxiety or depression. One of those is medication or medical health-related complications.
Yeah.
That's going to make the symptoms worse. Any increase in drug or alcohol use could possibly make it worse. And then environmental changes, any changes in your environment, where you're living, what you're doing.
You brought up drug and alcohol really quickly. I think that a lot of people self-medicate with drug and
Yes.
alcohol, and they have.
Oh, yes.
Oh, I
Anxiety.
could tell you, yeah.
We'll give-
But
We could tell stories, but we don't have enough
we
time.
absolutely do. Oh yeah, yeah.
Quick story. We only have 2 minutes.
Real quick, you're anxious, you feel like you should control it, you can't control it, you don't necessarily want to go see anybody about it, it's hard to explain. What are you going to do? You're going to try to take care of business by yourself. So the tendency to self-medicate is so common, so common.
And helpful?
Well,
It depends what you're self-medicating.
medicating with, and alcohol is a common one. And people say, well, that alcohol doesn't really help you. Well, it did help the person pass out and avoid the things that they were worrying about. So temporarily it helped.
It can numb.
Yes.
It can numb, but it's not fixing the
appropriate.
problem.
It's not good. That's right.
It puts it off for
Yes.
another day, and everything is
Right.
worse when you
Exactly.
wake up in the next morning.
Right.
Rapid City callers concerned about mental illness being treated in a city jail versus medical facility. Any thoughts about city jail or
That's almost too hard to talk about. I mean, there's so many different ways you can go there.
one sentence?
People who are in jails suffer for various reasons, including because of illnesses that affect their mental health. Yeah.
Yeah, and we should be, as a society, responsible for them as best we could.
Yes.
We should. What medication for anxiety is safe for use in a woman who's trying to conceive? Ooh.
You know, that's an interesting question, because there are some times when we'll use something and they're almost to the point where they're, okay, I'll take something,
30
and
seconds.
and they take it and they get calmer and then they conceive.
Yeah.
Being anxious makes it harder to conceive, and it's so anyway. There's certain more of the antidepressants. Sometimes the benzodiazepines are. You can use them until you get pregnant, and then after that, we have to back off.
Okay. And now for the winner of tonight's Prairie Doc quiz question. True or false? Fear and anxiety are part of life for everyone during times of stress and danger. When the feelings of unusual fear do not go away, even after the stress and danger is gone, the diagnosis is anxiety disorder. True or false? And the answer is true. It was George Henningsen of Sioux Falls who answered the question correctly. Thank you, George, for participating, and a book will be in the mail to you soon. And by the way, we don't have Margaret Apple's address from last week. Call in again, Margaret Apple, if you're watching, or if you know her, tell her to call us. We'll be right back after this.
Good day, citizens. It is with regret that I inform you that the end is near for me. I'm old, I'm tired, I'm weak. But don't go thinking that you've won the war against the flu. Before I go to that big petri dish in the sky, I will find a suitable replacement. Be warned.
During the summer after my freshman year in high school, my dad found a job for me working on a farm to teach me the work ethic. I remember hard physical work while hauling bales, long hours of labor, and profound loneliness while painting farm buildings. At the time, it was the most stressful experience of my young life, bringing me out of my lackadaisical youth and a tad closer to the world of a responsible adult. I have referred many times to the period in my life when I realized the value of the work ethic. It was a tough summer brought to me by my dad and a kindly farmer, and I became the better for it. Of course, this was nothing compared to what farm kids experience, but I learned that summer stress and hard work can be a very good thing. Similar hassles and challenges can be from many causes. Synonyms include tension, trauma, aging, money pressure, worry, fear, or anxiety from big or only perceived problems. It's a pull or push force exerted on a body resulting in strain with or without movement. One famous expert, Hans Selye, defined stress in two ways. There is distress or bad stress and eustress or good stress. He found that bad stress is having to face trouble without tools to cope or solve the problem. It's like being broke down in a field and you can't get the part to fix it. The famous Harvard study, which followed sophomore men for a lifetime, starting in 1938, discovered cholesterol, IQ, and childhood temperament had nothing to do with healthy aging, while smoking, alcohol abuse, and depression all had major negative effects. Healthy aging was best accomplished in a measured, not by money, but by how these people coped with tough times while finding ways to connect with self and others. Good stress is facing adversity and finding ways to solve problems or accepting them if they're unresolvable. Like exercise, it involves movement and is something to which you can become tolerant. As Selye put it, eustress makes you stronger, and the opposite is true. Without stress, our muscles, bones, and heart become weak. Indeed, it can be the trials of life which become good stress when we learn to develop ways to deal with adversity. Stress can give us strength, direction, and even purpose. Whether it's learning to work hard on a farm, dealing with broken down machinery, facing the inconsistencies of Mother Nature, experiencing long, lonely hours in isolation, or tolerating cantankerous humans. Stress is part of this life, and coping with it is a skill we need to develop. Well, a great big thank you to our guests, Dr. Tony Vaca and Dr. Jackman. According to state epidemiologist Dr. Lon Keitlinger, there have been 5 deaths related to influenza as of today. It would have been best for you to get your flu shot last October, but if you didn't, it is still a good idea as we're not out of the woods yet. So don't delay. Get your flu vaccine now to reduce your chances of catching the flu bug this season. It's killed 5 people so far. Well, that does it for tonight. From all of us here at On Call with the Prairie Doc, until next time, stay healthy out there, people. Take care. and welcome to On Call with the Prairie Doc After Hours. We had many great questions submitted beyond what we could answer during the broadcast portion of our show, so let's just get into those. A caller with OCD for 20 plus years. He now has a pulse rate so low they may need a pacemaker. Are they related? Slow heart rate, OCD, any relationship?
I don't know. I mean, I don't usually correlate the two together.
No, you'd think fast heart rate
Right.
with anxiety and stress, and the answer is
But you know, there's OCD, and then there's obsessive compulsive personality, and then there's people who have compulsive behaviors as a way to try to prevent the stress in their lives from coming in. So it may not just be OCD. That would be my first thought. But I don't know.
But correlation with a bradycardia or a slow heart rate, probably not a deal that you're not aware of it as an internist. I deal with slow heart rate. It just has a
Well, we have to know what other if this is a medicine-related effect too. I mean,
person might be on that beta blocker you were talking about.
I'd say 20 years of obsessive compulsive disorder, if that's a true diagnosis, there is treatment for that on an outpatient basis. Primarily it's exposure-based kind of therapy.
Okay. But probably not related to bradycardia.
Not
No.
that I've seen.
I think there's more to the story that would be needed to be obtained so we can better answer the question.
Make
but
sure that guy is off of any medicines that would slow the
no,
heart rate down.
no. Well, again, with the advice of your doctor.
Right.
Yeah.
Oh, talk to your doctor about it. Caller quit smoking 9 months ago after 50 years of smoking.
Good job.
Good
That's
job.
awesome.
Now TV commercials about smoking cessation bother him to the point that he has to turn the TV off. Why does this make him so upset? Oh, that's an interesting.
I'd say one is it's a trigger, it's a reminder of the very thing that he had difficulty breaking from. And so oftentimes when we, whether it's post-traumatic stress or anything associated with the problem we were having, it triggers some of that same emotional response or inside of us. And so my guess would be that's probably what some of that is. It's a reminder of the very thing he's struggled with.
It keeps bringing up the idea of smoking.
Correct.
What do you think, Tony?
I would concur with Dr. Jackman.
Caller has anxiety for decades. Her father also had anxiety and depression. She assumes she will have this all of her life. Would the guests agree with this assumption?
Oh, no, the guests have some questions here, okay? So are we talking about disorders? Because to have symptoms of anxiety, again, those are symptoms. And are they impairing enough, chronic enough, intense enough to call it a disorder?
Right.
Same thing with mood disorders. And then we're talking about what kind, because there's different types of anxiety disorders, and there are different types of depressive disorders. And you would think that the treatment would be very similar, but there can be some differences. Right. And it's really important to really better define what we need to do. And you know, most of my training, Rick, has to do with trying to figure out the diagnosis. I mean, the medicine part is not, I went through medical school. I can understand the medical part, but you have to figure out what the diagnosis and what your treatment is first. And if you can nail that as much as you can and really make sure that's the valid one, then it gets a lot easier to treat. But it's hard to treat if you don't know what you're treating. And so that's the importance, I think, of seeing a psychiatric provider, psychologist, to better idea really what we're treating. You have to start there before you can go forward.
Does my sense, though, is that she did inherit it. It's a genetic thing from her father, and that she may have it all of her life unless she learns to cope with it. And
And some of those symptoms she may struggle with, but the actual disorder where it's carrying over into occupational, that may not necessarily be true if it's treated appropriately.
Right. It's interesting what you said about making the diagnosis so important. In my mind, I don't think that's the common psychiatric way the psychiatrists usually address. You must be a especially good psychiatrist.
No, that's part of my training is to try to figure out what we're trying to treat. And that's what your training is in with medical illnesses.
Yeah. Right.
Otherwise, it gets if you don't know what you're treating, it's frustrating for the person, but it's frustrating for me because I need to know what I'm treating, and so I can offer the best recommendations possible.
Right.
Otherwise, I get really anxious about
You get
making
anxious?
sure that I have the right diagnosis.
And the same holds true in the outpatient clinical setting too. You want the right diagnosis, or whether you have the wrong interventions and treatment.
Can death in a family be a cause for anxiety? Wallace.
Certainly. I mean, it's a stressor, and any stressor could, again, increase the likelihood of the depression or anxiety certainly getting worse.
But so people have commonly said, okay, I've been really bummed out, I'm struggling so bad, the death in the family, 6 months later, still struggling. Is there, that's been the timeline that people have spoken about. What do you think about that timeline, both of you?
Well, we could make a case for different types of disorders associated with that being 6 months down the timeline. I guess I would just question what the reason is that person doesn't go in and maybe get some help or get a consultation and see if this is actually something that needs to be treated.
Yeah.
Well, again, it's all about the degree of impairment. So 6 months is a long time.
Yes.
That's half a year. So at what point does it get hard to sleep? At what point are you mourning the death of a loved one that you're taking away from quality time from your own family?
Yeah.
Is it taking away from your own time to be healthy, i.e. from relaxation, exercise? Those are more important to me than the timeline.
Okay, interesting. Last question, is alprazolam, which is one of the benzodiazepines, a suitable medication for an 89-year-old woman instead of a sleeping pill? This will be yours, Tony. Sleeping pill, 89 years, taking a benzodiazepine at night.
Generally not what we try to do. Now again, people are different and there's different situations and we look at the histories. But what the question again is pointing to is that we're using a medication before going to bed. So how long does the medicine last? The risk that we're worried about is person waking up in the middle of the night and falling. Or waking up in the middle of the night and not knowing what you're doing and where you are. So those are all important factors. Alprazolam, or Xanax is the brand name, is a very good medicine when used for the right reason. I don't think you will find too many psychiatric providers prescribing that medicine at this age. Again, the individual histories need to be taken into account, but this would not be high on our list.
And if you look at the cost of falls in America, it's in the billions. How much it costs the society, but that's dollars. Think about the suffering that people have with broken hips. And at 89, you're at high risk of a broken hip from a fall. So you would really want people to strongly consider another option instead of that one. I kind of prefer, if I were going to pick a drug, if I had to use a drug in the elderly, I use trazodone at night. What do you think?
We'd have to see what the blood pressure is. We have to see what other medications. One medication that can be helpful is melatonin. But melatonin needs to be thought of, though, as a sleep transition pill, not as a sleeping pill. It helps you get ready for sleep, but you can't really think of it as a sleeping pill. There are some people who actually will say, shortly after I take it, I get really tired, just like they were, but that's usually not the case. But, people abuse their sleep so much. And so before we really start looking at using a medicine, let's talk about what we can do to avoid using a medicine.
Right.
And that's the cognitive behavioral therapies and way to relax and preparing for sleep. That's there's so much education involved in that.
I see alprazolam and the benzos for a sleeping pill sort of like the stimulant laxatives for constipation. You use it for a couple days, your bowels work pretty good, and then pretty soon you got to go higher doses, and then pretty soon if you don't increase the dose, you're back where you were before. So you stop the medicine, and then you have withdrawal constipation, and so you go, oh, I've got to take that pill every day, and you stay on it all your life with a miserable problem that doesn't ever resolve until you go into the nursing home and I take that pill away, and in about 2 weeks they're back to normal.
Could I make one more comment that's related to this question? And this is going to be, I think, very important, is that over the years I have seen people who have walked in as if they are ashamed and embarrassed about being on medications that they know may be controlled medications, but that they have tried to go off and have difficulty doing so and have maybe remained on the medicine for years. And sometimes the person who's actually prescribed the medication over the years gets uncomfortable about the fact that they are on the medicine for the years, and then they try to encourage that person to get off. There are some of these anxiety disorders, generalized anxiety disorder in particular. That's like high blood pressure. It just will be there. It may be there for the rest of your life. There are illnesses, generalized anxiety disorder, not everyone, not all generalized anxiety, but some illnesses where you're going to have to be on these medicines for a long time. And we, again, through the education and process and trying to figure out, again, what we're trying to treat, we have to make sure that if they need the medication and being on the medicine makes them happier and healthier, then that's okay. And they should not feel embarrassed about doing so.
Or guilty.
Absolutely, because generalized anxiety, for instance, or worry word anxiety, which is another word for generalized anxiety disorder, it just may be there for a long time, and you should not have to feel embarrassed because you're on a medicine that you're taking respectfully, that you are not abusing, and if it's and again, that's just an important. I see that, and I feel sorry for those people.
And you needed to say that because I've made all these rather negative benzodiazepine comments, and there's a time for it. So,
there's times for it.
okay. Well, we thank you for joining us on our website. We appreciate all your questions and the opportunity to answer them. So until next time, from all of us at On Call with the Prairie Doc, stay healthy out there, people.
The circulatory system carries oxygen and nutrients to our cells. It brings our body's defenses to attack disease. We need it to work properly. Heart and circulatory diseases. Next time On Call with the Prairie Doc.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information.
And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota.
and with the ongoing support of these individuals and institutions.
Brookings Health System, Ophthalmology Limited, South Dakota State Medical Association.
Avera Heart Hospital, Dakota Allergy and Asthma, Fishback Financial Corporation, Vance Thompson Vision,
Aberdeen Asthma and Allergy, Black Hills Medical Society, Dakota Bank, Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, Regional Health, and Swift Tel Communications.